and welcome back. I'm wearing bright flowery clothes today because we're going to talk about seasonal allergies, something near and dear to my heart. Everybody in my household suffers from them, and everything is in bloom right now in Oklahoma. So strap in, we're going to have some fun. First of all, most of you who have seasonal allergies know that a certain time of year, whether it is spring and all the trees are in bloom, or it's early fall and the ragweed is bad, you know kind of what to expect. I'm just going to give you some good helpful tips to help you manage those symptoms so that hopefully you don't spend the next couple of months miserable. What can we do to help mitigate these symptoms without taking medicines? Well, one thing is use a sinus rinse when you get inside after you've been outside, and try to wash all of that pollen and the mucus out of your nose. Another thing we can do is avoid being outdoors for prolonged periods if you can. If you have to be outside, make sure and take a shower and wash your hair as soon as you get inside to help wash all of that off of you. It's the pollen and the other substances that your immune system has a response to. It's really nice when the weather starts getting warmer, but most allergists recommend not leaving your doors and windows open, especially while you're sleeping at night, because it just lets pollen have free rein to come in and get in your house. Wash your pillowcases and your sheets frequently. That helps keep everything clean and helps keep those germs out of the way. You can also buy pillowcases and mattress covers that help keep pollens and other allergens from getting into them, and you can buy them pretty much anywhere.
Let me in! Let me in!
If all these prevention strategies fail, what do we do as far as medicines go? The mainstay is antihistamines. We're talking things like Benadryl, Zyrtec, Claritin, Allegra, etc. And really, you just have to find the thing that works best for you. Most people can't function on Benadryl during the day, so if they need to, they can take it at bedtime. During the day, we recommend medicines like Claritin or Zyrtec or Allegra, or the newer versions of those, Clarinex or Zizal, depending on if those make you drowsy or not. I have some people that feel like they sort of get used to these medicines, and so they'll rotate them from time to time, and that usually is a pretty effective strategy. Some people need to take these medicines every day to help keep symptoms at bay. Some people can just use them on an as-needed basis. That's sort of up to you. If this doesn't work by itself, then we start adding in other combinations. Sometimes you can get prescription medicines. One of the more commonly used is Singulair or Montelukast. It blocks leukotriene receptors, whereas antihistamines block histamine. And so it is just a different mediator of inflammation that we are targeting with that type of medicine. It is okay to take antihistamines and leukotriene receptor modulators together. If those oral medicines don't work, or if you just prefer to take something nasal, that's fine too. There are several nasal steroid sprays that are over the counter now, such as Flonase or Nasonex or Nasacort, and those are okay to take every day too. The nice thing about these medications is that less than 1% of them gets absorbed into your whole system, so you're really depositing the medicine just where it needs to go, in your nose. And interestingly, people who use these medicines also have relief from eye symptoms and sometimes eustachian tube dysfunction as well, which is where when your ears get plugged and pop a lot. If you have severe eye symptoms, or if your symptoms are just predominantly in your eyes, you can certainly get drops for those as well. There are prescription drops and over-the-counter drops. If the over-the-counter stuff doesn't work, ask your doctor for some of the prescription drops. In addition, there are nasal antihistamine sprays, Astelin, Astepro, and Patanase, and they work differently, just like the oral medicines have different mechanisms of action, and so it's okay to use one of those along with the nasal steroid spray or by itself. When you use a nasal medication, one of the things that I like to tell my patients is don't take a big sniff. When you see someone taking an asthma inhaler, they do need to breathe it in so that it gets in their lungs. But if you sniff really big when you use a nasal spray, it's going to go down the back of your throat and into your stomach. And we don't need it there. We need it in your nose. So spray. If you need to take a little sniff, that's fine. If you feel like it's going to drip out, it's okay to pinch your nose and hold it there for a few seconds, because all those blood vessels converge at the tip of your nose. So some of it will absorb that way. Then if you have any excess, just throw it away. If you have tried all or a combination of these medicines and you're still having severe limiting symptoms, then you may need to go see an allergist and have some formal allergy testing done, perhaps even get on allergy drops or shots. That's up to you and is out of my wheelhouse, but is certainly a tool in the toolbox if your symptoms are severe enough. One of the things I like to tell my patients is, if you know the time of year that your allergies are going to be bad, don't wait until your symptoms are bad and you sound like this. Start taking the medicine a week or two before you anticipate whatever might peak, based on when it usually happens in your area. There are plenty of websites where you can go to find that. One of my favorites is pollen.com. You enter in your zip code and they will send you the pollens that are elevated in your area. So, with a little knowledge and a little planning ahead, hopefully you can help keep your symptoms at bay. Don't forget to like and subscribe, and stay tuned.